Good afternoon, everyone, and welcome to today's press conference and launch of the report, Caring About Care Workers, Centering Immigrant Women, Personal Support Workers in Toronto's Home Care Sector. I am Jin He, Executive Director of Social Planning Toronto. We are a nonprofit charitable organization whose mission is to challenge inequity in our city through research, civic engagement, advocacy, and collaboration to spark social and policy change. Before we begin, I'd like to start by acknowledging the current stewards of this land, the Mississaugas of the Credit First Nation, and this area is covered by Treaty 13 and the Williams Treaties. We are very excited to be sharing with all of you our new research that centers the experiences of personal support workers, namely immigrant and racialized women, working in home care, and the critical role they play and the challenges they face despite many gaps in Ontario's healthcare system. Today, we will start with a presentation from our researchers, Beth Wilson and Dr. Naomi Lightman. We will then have some remarks from Connie, Ndlovu, and Ella Tan based on their expertise working in the sector. Then we will take questions. First, I'd like to introduce Naomi and Beth. Dr. Naomi Lightman is an associate professor of sociology at Toronto Metropolitan University. Her areas of research expertise include care work, migration, gender, and the critical social policy. Beth Wilson is a senior researcher with Social Planning Toronto. She has contributed to the research, policy, and advocacy work of the organization for more than 20 years. Beth and Naomi, welcome.
Great. Thank you, Jen. The Caring About Care Workers project is a collaboration between Social Planning Toronto and me, Naomi Lightman, from Toronto Metropolitan University. The research was and is motivated by a broader understanding that home care personal support work labor is invisible to many, as well as being economically and socially undervalued. Yet PSW home care labor is essential to many of the most vulnerable people in society, including seniors, people with disabilities, and individuals recovering from hospital stay. The project's objectives are to understand the working conditions of immigrant women PSWs in Toronto's home care sector, and specifically to highlight and amplify the lived experiences of these women and hear their perspectives on what are the most critical issues they face and their suggestions for system reform. So rather than being purely descriptive, it was important for us to have a strong policy dimension to this work. Based on these interviews, we aim to provide specific recommendations to improve working conditions and build the collective power of PSWs in home care. Given our objectives, we chose to speak with two distinct groups. Our priority was to speak with immigrant women PSWs themselves. We conducted semi-structured interviews with 25 immigrant women PSWs from a broad array of backgrounds, individuals who had come from a variety of countries and who had worked in both the not-for-profit and for-profit sector, and those that were unionized as well as those that were non-unionized workers. For our second group, we also chose to speak with 7 organizational representatives from community agencies and labor unions who worked in areas connected to PSWs and home care. From our research, 4 key themes emerged. First, we found that PSWs, who are the lowest paid workers in home care, are subsidizing the provincial home care system with their unpaid labor. This is in an effort to provide clients with high-quality care and to cope with unmanageable demands on the job. Using their personal unpaid time, PSWs are working beyond their paid hours just to provide adequate care to clients. And you can read the powerful quote on this slide from Connie and Ndlovu, which highlights this issue so well. Precarious employment is widespread in the home care sector. And this is well documented in existing literature as well as research. So our second key theme is that the provincial home care system offloads costs onto personal support workers. Research participants explained that they receive low or no pay for their travel time, are not fully reimbursed for travel costs, and often experience long gaps of unpaid time between clients. PSWs also routinely have their hours reduced and lose hours when clients move, enter hospital or long-term care, or pass away. These unfair working conditions are due in part to insufficient funding and an inequitable funding model based on a standard hourly rate for personal support services. Many health and safety concerns were also raised by home care personal support workers, and these were often tied to working alone without on-site support in private homes. While our participants conveyed that they deeply value their relationships with clients and see their clients as among their most important allies, they also discussed cases of traumatic experiences with clients where they were subjected to anti-Black racism, sexism, violence, and harassment. Some participants detailed injuries incurred on the job, as well as negative physical and mental impacts of working through the COVID-19 pandemic. Our fourth theme highlights that low wages, precarious employment, and poor working conditions drive home care labor shortages with grave consequences for Ontarians. Notably, the provincial government has projected that by 2032, an additional 50,853 PSWs will be needed across all sectors. Yet nothing is being done to retain PSW workers in home care. Participants identified the major contributors to staff retention problems as being a lack of guaranteed work hours, inadequate work hours, low wages, and a lack of wage parity for PSWs across sectors. And of course, when home care is not available, people turn to more costly forms of care, such as hospitals, emergency departments, and long-term care homes, driving up overall system costs. And now I'll pass it over to Beth Wilson.
Thanks very much, Naomi. The report includes 3 case studies that provide a broader context for understanding the working conditions of home care PSWs. The first case study traces the origins of the current home care crisis back to the late 1990s, when service delivery was privatized and open to for-profit companies. These reforms destabilized the home care system to the detriment of home care workers, recipients, and their families, disproportionately impacting women, including immigrant and racialized women home care workers. Our second case study examines the potential of a public, nonprofit home care system that prioritizes high-quality care and decent work for home care workers. We take a deeper look at the problem of profit in publicly funded home care, and we conclude by examining the potential role of home care worker cooperatives within a public nonprofit system. Our third case study recognizes the importance of unions as a vehicle for improving working conditions, and we highlight an organizational interview with home care PSW and labor leader Connie Ndlovu, who will be speaking on the panel shortly. Our key recommendations from the research are informed by our interviews with home care PSWs, and I want to share some quotes with you from these essential workers. Definitely, we need more job security and we need more time. Whoever is funding the services to extend the time for clients to give the proper care to the client, and also for us to avoid all the stress and the burnout. I told my superiors that, to keep your employees, you should give them benefits, retirement, pension, and what other companies are giving. They said they couldn't afford the benefits, but I think they should. It should be uniform. I believe the government should really look into paying PSWs more than what they are, because the work is difficult. The wage does not compensate for what we have to do. The cost of living is going up, but the wages are not going up. With the traveling time that we spend on the road, I believe that we should be compensated for the time spent. And we have 3 key recommendations in the report. Our first key recommendation: ensure fair compensation, secure employment, and protections for home care PSWs. And we call on the provincial government to achieve wage parity for PSWs across sectors, ensure guaranteed and reliable work hours, full compensation for all work hours, including travel time, access to employment benefits, protections to support the health and safety of home care PSWs, and a sectoral strategy to protect workers from anti-Black racism and other forms of discrimination in home care. We also make recommendations to address concerns of injured workers, pandemic readiness, and organizational strategies to address racism and discrimination. Our second key recommendation: transform Ontario's home care system to support good working conditions for PSWs and high quality care for Ontarians. And these recommendations focus on transformational systems change at the provincial level. We recommend the creation of a public, nonprofit home care system, an end to profit in the publicly funded home care system, to ensure that every tax dollar supports high quality care for Ontarians and decent work for home care workers. We recommend the adoption of a grant-based funding model for home care to support the full cost of care provision, the development of employment standards, and improvement of public transparency and accountability in home care. We also speak to the role of the federal government to list home care as an insured service, to tie funding to system improvements, and to develop national home care standards. And our third recommendation is to build the collective power of home care PSWs. We call for the provincial government to reform labor laws to improve access and reduce barriers to unionization for home care PSWs. For the labor movement to dedicate more resources to organize with home care PSWs, and for the community sector to support PSW networks and leadership development opportunities for home care PSWs. And we also support workers' rights campaigns, solution-focused research, and workforce development practices to promote decent work in home care, and senior orders of government to support worker co-op development. And I will now turn it over to Connie and our panel. Thank you.
Just going to introduce Connie first. So Connie Ndlovu is a Black woman who arrived in Canada as a refugee from South Africa. For more than 20 years, Connie has dedicated her career to home care. Currently, she serves as the president of CUPE Local 7797, where she continues to champion the rights of home care PSWs, workers who are predominantly Black and racialized immigrant women. And then following Connie, Ella Tan will come up, who is a registered social worker who has been working with paid care providers for more than a decade. She is the employment and family support worker at North York Community House and focuses on challenges and trauma related to migration, particularly in the Canadian Caregiver Program. So we'll have Connie up first.
Thank you for that.
Okay, thank you. Good afternoon. My name is Connie Ndlovu. I'm a personal support worker in home care and the president of CUPE Local 7797, which is a union that has about 600 personal support workers working in home care. I want to thank Social Planning Toronto for including me in this project, a very important and powerful project where I begin to see some hope. The recommendations that are put in this document, I don't know how anyone politician can ignore the crisis in Ontario home care system. But I'm standing here to really speak that the responsibility won't just lie on the government, but the unions will have to play a very bigger role. I know there's organizing, but I think there's lack organizing when it comes to home care workers. I'm able to speak and stand here and talk about my rights in home care because I am in a union. If I was not in a union like many of my friends who are not in the union, the exploitation is unbelievable. So it's really going to be up to the unions that these workers are not left behind, that these workers are protected, because when you are organized in a union, you are able to refuse unsafe work. You are able to talk about poor working conditions. You are able to talk about your rights as a worker. For home care workers, joining a union is not an option anymore. It's a call for human rights. It's a call for justice. The unions, big unions like CUPE, other unions like SIU, they need to put resources. There's many home care PSWs out there who look like me, who are not in labor, who are newcomers, who are afraid to rock the boat about their rights, about their safety, because they are not in a union. They're still struggling with the immigration system. They might be deported. But when you are in a union, you are able to talk about these things. You are able to talk about racism. You are able to talk about policy. We are able to sit at that bargaining table and put language in the collective agreement that is going to hold the employer accountable. We are able to go to Queen's Park and lobby for more funding. I was at Queen's Park when Kathleen Wayne was the Premier of Ontario. We got that $2.40 wage enhancement because we were talking with a voice from labor. We're not home care PSWs without representation. We wouldn't even make it to Queen's Park. We got the $2.40, but it was nothing. It's not enough. Home cares they're exploited. If you're gonna work 3 hours a week to be able to raise a family, pay rent, that's not acceptable. We are workers who are doing essential work. Many workers who work in long-term care, they are unionized. They are in a union. They are doing the care work that we do in home care with the same training. So I think labor has to stand up, put resources. There's challenges of organizing people in home care because we work in isolation. It's difficult. I'm not saying it's an easy job. It's not easy, but also it's not easy to continue to work in this sector when we are treated like second-class citizens, when we are treated like we came to this country just to do manual work. We came for greener pastures. We came to make a living. We came to make our lives better so that our children have hope tomorrow. And this is the work we want to do. This is the work that we love to do. And you know why we love this work? It's because the people who receive this care from us depend and rely on us. They don't want to go to long-term care before their time. They don't want to go to nursing homes before their time. They've got rights to stay in their homes and get the help like anybody, whether they're in long-term care or they're in the hospital, but even in your home. Personal support workers like me must give you dignified care. But I must also be treated as a professional, be recognized for the work that I do, and be valued for the work that I do. And I know that many people who are in the union, their work is valued. But the unions know about our work. But they are really moving very slowly. I've worked in home care for over 20 years. I stay in the subway waiting to be called for another hour. The hours are still very precarious, even when we're in the union. But the benefit that we can talk about our rights. You can say, you know what, we need more hours. But when you don't have a union, you are going to work with a sling because you broke your arm. You can't stay home. You don't have sick time when you're not in the union. Even if we don't have enough sick time, even if we're in the union, but at least I can stay home. So it's very important that this report actually, it also touches on labor. It's asking the unions to do something, to put more resources, efforts to put people out there. Who's going to organize PSWs? We will organize ourselves when we have the resources because we know each other. I can go to the subway right now. I see a person carrying a bag this side and the bag this side. It's a woman, a racialized woman. I know that's a home care PSW. We have an identity. We know each other. But for me to organize those people or call another PSW to organize these workers, there has to be resources. It has to be full-time jobs. And when we've gotten workers who want to organize, we need to move quickly because we've got the resources before the employer gets involved. Because many of these workers, some of them, they're still trying to get their papers. So they don't want to rock the boat. They're newcomers. So if I'm not there tomorrow to show up and take their names and meet with other people, then they'll be afraid. Like, what is Connie up to? I don't want to be deported. There's just so much that the labor can do to make our lives better. Because when you make my life better as a home care PSW, we are making my family's life better. I'm not just a body working there. There's people that I've left home who are depending on me. The precarity of the work in home care is a crisis. And I believe, strong in my bones, that labor can save home care workers. And labor can save home care. Because labor wants public programs to stay public. They want funding to go to public programs. And home care is a public and must be a public program. Thank you.
Good afternoon, everyone. Thank you so much, Connie, as an employment and family support worker, I can really understand where that emotion is coming from. So I'll be very quick. The research findings are unfortunately not new to me. After having been working with personal support workers and caregivers for almost 13 years, we are still confronting the same challenges highlighted in the study. And in my role as a family support worker, my contribution focus on resume support, providing referrals to personal support workers so that they can access resources around the community and support their families. And of course, providing emotional support for personal support workers. But deep inside, I still feel that I and we as a system should be doing more. Many of the support that we provide, I feel like it's like a palliative, a Band-Aid solution. And yes, we are addressing the immediate needs of personal support workers and as an organization, but we are still unable to break the entrenched systemic barriers that leads us to the same dead ends. yes, we offer these services, but we are confronted with barriers after barriers. And far too long as an organization, and I think with other organizations, we do have the important information from our clients, but we just don't know how to use it and where to use it. And part of the problem is that there is a lack of strong data, and we do not use the platform that we have to elevate the lived experiences of personal support workers. And so, and this is why these research findings are very important and that they matter, because they validate what personal support worker has been voicing for many years. And this actually, the findings and the recommendation makes me hopeful as a personal, as an employment and family support worker, because I feel like we're moving to the right direction towards policy change, and not just a lip service, but grounded in data, lived experiences, and of course, collective actions. Thank you.
Thank you so much. That concludes our presentations for the press conference. Thank you so much to the report authors and our community experts, Naomi, Beth, Connie, and Ella, and thanks everyone here.